Hey, how's it going, brain health listeners? Today we're going to learn about caffeine. We're going to learn everything about the substance, what its mechanism of action is, and how it works on the brain. I'm going to ask that all of you subscribe to the channel and to the podcast, Brain Health with Dr. Nissen. Without further ado, let's dive right in. So, caffeine. This is the most commonly used psychoactive substance in the world. I'm enjoying some coffee right now, and it's found in a lot of different things other than coffee. Let me take a sip. It's found in chocolate, tea. It's found a lot of candies and sodas, and it's even there's enough in those different substances to where you can measure a degree of caffeine intoxication in a child after just a candy bar and a soda. And so it makes you wonder how many kids are running around technically intoxicated on caffeine. So one coffee has around 100 to 150 milligrams of caffeine, and the average American consumes around 200 milligrams per day, which is around two coffees or one coffee with some candy or a soda. So the mechanism of action is related to adenosine. So caffeine is a methylxanthine. So this is a substance that works on the G protein coupled receptors of the adenosine receptors in the brain. So what happens is they basically caffeine blocks the adenosine receptors, and adenosine is really important in the body's sleep-wake cycle, and in particular in sort of the accumulation of sleep debt. What happens is when you drink caffeine, it's blocking those receptors, and it's sort of artificially prolonging this sleep debt that's occurring. And as long as you have those receptors occupied and the adenosine can't bind, you may not feel sleepy, but that adenosine is going to stay close. So as soon as the caffeine starts to come off, then there's going to be more adenosine to hop onto it. So that means that you sort of get this like spring-like effect where the pressure of the amount of adenosine that's growing and ready to pounce on these receptors increases as we're drinking caffeine. So as soon as it comes off, we crash really hard. So that's really what's happening in the brain and in the body when we're using caffeine. So as a methylxanthine, it actually is similar to theophylline, which is a medication commonly used for asthma and COPD. That this is one thing that's really sort of dangerous to mix with caffeine, because it further blocks adenosine's effects and can have some effects on the heart as well. So with around 300 milligrams of coffee, so 2 to 3 coffees, if you're drinking large coffees, that could be as much as 1 or 2, you're occupying around 50% of the brain's adenosine receptors. And these adenosine receptors, like I said, it will take several hours for them to become unoccupied. This is because the half-life of caffeine, which is how long it takes for half of caffeine to jump off the receptor, that half-life is 5 to 7 hours. So you could say 6 hours that it takes for half of it to be gone. So, the practice of drinking coffee after dinner, for instance, if you're drinking that coffee around 9 or 10 p.m. after a late dinner, that it's going to stick around well into the night and even into the morning. So for people that have difficulty falling asleep, it's certainly not advisable to drink coffee with dinner. And you would need to have at least 2 half-lives in order to have 75% of the caffeine removed from your receptors. So that's 12 hours. So for people that struggle falling asleep, it's really not smart to drink coffee really after the late morning, after 10 a.m. or after afternoon for sure. So the peak concentrations of caffeine are felt about 30 to 60 minutes after ingestion. And there's a few different effects that this will have. So if you have too much caffeine, this particularly in people who are very sensitive to it, who are drinking a lot of coffee, or who drink or consume caffeine supplements on top of coffee, or just too much by themselves, you can become tremulous. You can have insomnia, like I was just discussing. You can have sweating, irritability, flushed face, nausea, GI complaints. And at very high doses, over a gram, you can get rambling speech, confused speech, arrhythmias, visual hallucinations, light flashes, irritability. So think about, um, the people that are taking supplementation of caffeine, in particular people who are drinking, highly caffeinated, like energy drinks, in addition to like pre-workout supplements. These are the sort of like really dangerous intoxications that can occur and even result in those heart arrhythmias, like I was referring to, that can be deadly. And above, so these start at above a gram. Above 10 grams, you can have these tonic-clonic seizures, respiratory failure, and death. Um, so the at the low dose, which most people experience it increases intestinal peristalsis. So that's the wave that's going through our intestines, and that's why people like to say that coffee makes them poop, because it does increase the intestinal movement, and it increases alertness, improves verbal and motor performance. And it causes gastric acid secretion. So for people that have signs of ulcers or GERD, so reflux, hiatal hernias. These are all things in the belly that can really be, bothered by caffeine consumption. Um, so in general, people that have insomnia, people that have gastritis or GERD, stomach issues, hernias, they should be, really considering stopping their caffeine consumption. And there, you can be tapered down if you're taking very high doses of caffeine to not have a really abrupt crash. And that taper can be over 7 to 14 days to make it sort of more comfortable for people that are really kind of abusing caffeine. There are some theoretical concerns associated with caffeine. There are some possible cardiovascular risks of caffeine that I mentioned, including its effects on blood pressure, heart rate, and at very high doses, its ability to cause arrhythmias. Um, there's some evidence that can slightly delay conception in women who are seeking pregnancy, and can vary in very small degrees, minimally decrease birth weight in an infant. These concerns have primarily been seen in patients consuming very high amounts of caffeine, like over 500 milligrams a day. But for patients that are consuming very high amounts, they definitely should be counseled on decreasing the amount of caffeine consumption they're having during pregnancy. And for those who are experiencing withdrawal, usually that withdrawal from caffeine is treated with something like aspirin or ibuprofen, for the headaches and the body aches or muscle stiffness that can occur. Um, so a good way to kind of approach this, if you're interested in caffeine, if you're interested in cutting back your caffeine, is to journal and really find out kind of how much you are consuming. If you're, taking a dose of a supplement, that will be easy for you to calculate. But otherwise, for a lot of people, measuring the amount of coffee, chocolate, soda that they're consuming, it can be difficult to know. So start with a journal and really get an idea of how much you're actually consuming. And then if you're, consuming significant amounts, to do a taper over several days to not make yourself feel so uncomfortable. So, if you're having 5 coffees and 5 Diet Cokes a day, then, you can cut it down to 4 and 4, and then to 3 and 3, 2 and 2, 1 and 1, to make it so that it's not such an acute sort of crash. And then a lot of people find that their reliance, particularly with coffee or tea, come from just the enjoyment of a warm beverage, especially in the morning. And so you can consider switching those out with things that are not caffeinated if you have an issue with caffeine. So things like decaffeinated teas, although they're not 100% decaffeinated. Same with decaffeinated teas and sodas. So these are some different options. So that's some information about caffeine, how it works, the effect that it has on the body. And I hope you found this helpful. Again, subscribe, listen to the Brain Health with Dr. Nissen podcast, and have an awesome day. You guide me.